Hello, for my field experience for advanced practice seminar or leadership experience, I taught hands-only CPR to UPS employees in Hiawatha, Iowa, who are interested in learning. The American Heart Association has done a campaign to increase the number of people educated on hands-only CPR and to decrease the amount of cardiac deaths. One reason why hands-only CPR has become so popular is the research has shown that people who do not get CPR might not get it because the bystander, the person who found the person down, did not want to do mouth to mouth. We have learned this in our BLS training that compressions are really the most important when doing CPR as they keep the vital organs alive. And it also buys some time until someone with more skills can come to the scene. I chose this experience because I am a cardiac nurse and we teach hands-only CPR to patients and family members who are admitted to the hospital at risk for cardiac death. People who are in the hospital often are not in the best state of mind to learn, and especially if it's a new diagnosis, it can be really hard on the family members. But there is a video we show patients and mannequins if the patient or family member wants to practice hands-only CPR. The mannequins are helpful because they have a hard click that educates the patient and family member whether or not they're doing the 2 inches depth. The mannequins I was able to bring for hands-only CPR are super awesome and new. You press hard and fast and it actually lights up and shows whether or not you're getting the blood flow to the brain like you need to. And it still has that click, but it was really fun to use them. I learned during this experience that a lot of UPS employees are interested in learning about the Heimlich maneuver. I thought that was interesting because I wasn't really prepared on talking about it, but it brought up good discussions. Employees wanted to know, how to do their loved one if they had a child or saw someone choking, how to do the Heimlich. And it was important to talk about with the baby, you want the baby facing down and the thrust. If you yourself are choking, you can go behind a chair and, kind of jab yourself with a chair to get the whatever you're choking on out. I thought that was interesting that the Heimlich came up quite a bit. Also, when I was educating the UPS employees on hands-only CPR, we talked about the Good Samaritan law saying that the Iowa protects first responders who are voluntary in their CPR ability and acting in good faith and administering CPR for these people, because a lot of people who aren't educated on whether or not they will get in trouble for doing CPR and someone that wanted to did not know about the Good Samaritan law. This research project and educational opportunity provided by the community will affect my current practice because I know we have these really awesome mannequins at St. Luke's and we can educate patients and family with those now, but also my future practice because I did not imagine that UPS employees would be excited to learn hands-only CPR. I figured they would want to go about their day and get their job done, especially busy time of year that I went. I think it is important to be able to educate the community regarding marketing opportunities. If you are in a rural setting, maybe you want to educate the public and get your name out there as a provider, as a new provider. I think it'll be really helpful to educate people on, illnesses happening in the area or, health resources available to the community. Nurses are super, we talked about this a lot in our discussion posts, but nurses are great educators in teaching the public about excellence and standards of practice and evidence-based care, which I think I will take with me in my future practice, thanks to the help of this advanced practice seminar class. Overall, great field experience, and hopefully we can save more lives by educating more people about hands-only CPR. Thank you.